treating Ebola patients in West Africa. This Stanford doctor has become the first person in California to be under quarantine. The doctor has shown no symptoms of the deadly disease.
But tonight he tells us why he's not taking any chances. Ann Notarangelo is live in Palo Alto with what the doctor can and can't do. Ann?
And Dr. Colin Bucks is taking his temperature every day. He's contacting the San Mateo County Health Department twice a day so that they can monitor his health. But as you said, he is showing absolutely no signs of Ebola. But the doctor just returned from Liberia last week, and when he arrived back, there were no guidelines. So now he is starting the 21-day quarantine. But when he got here, they decided to pool together their resources. What should they do? They came up with this. They came up with that he should not go to work for 3 weeks. He should limit all of his personal contact for 3 weeks. They did concede that they'd let him go jogging once a day as long as he was alone. So he's always been monitored ever since he got back from Liberia. But what is new is this quarantine. He told KPIX5 this afternoon by phone, "I'm California's most experienced Ebola physician. I won't take a single chance. My wife is away. My dog is away. There's no downside but a little personal inconvenience, and 3 weeks will pass." Now, he spent a little over a month in Liberia working with the International Medical Corps, working directly with Ebola patients. Here's Dr. Bucks in a New York Times video talking about the work being done in West Africa.
And also this is a medical public health emergency. When I saw the news of the outbreak occurring, it wasn't really so much whether I would go, it was how and in what capacity.
So Dr. Bucks gets that there might be some hysteria. At least there is concern over the Ebola and the concept of Ebola. But he does say that he does believe that the CDC is doing a great job, and he applauds their efforts. At Stanford, Ann Notarangelo, KPIX5.
California is now the latest state to order quarantines for travelers who came in close contact with Ebola patients in West Africa. New protocols issued today require county health officials to evaluate people on a case-by-case basis. The amount of contact a traveler had with Ebola patients will affect their type of quarantine. It could range from observation and monitoring to the limitation of movement.
President Obama says there could be more cases of the Ebola virus diagnosed here in the U.S. in the weeks to come.
We can't hermetically seal ourselves off. The nature of international travel and movement means that the only way to assure that we are safe is to make sure that we have dealt with the disease where right now it is most acute.
The president thanked doctors and healthcare workers who joined the fight in West Africa. He says government policies to stop the spread of Ebola in the U.S. should be based in science and not fear. Now, the U.S. military is taking extra precautions. Defense Secretary Chuck Hagel approved plans to keep troops returning from Ebola response missions in 21-day quarantines. Now, that would apply to the more than 1,000 U.S. troops who are currently helping in the fight against Ebola. Meantime, a nurse in Maine who treated Ebola patients in West Africa says she will not follow her quarantine orders. Casey Hickok says that she is showing no symptoms and plans to take herself out of quarantine tomorrow. Maine officials are in the process of filing court orders to keep her in isolation. Hickox was the first person forced into New Jersey's mandatory quarantine.
There are